Hi, I'm Dr. Ken Lipstock. In this section on cataract surgery, we're going to talk about laser-assisted cataract surgery. If you haven't already listened to the introduction to cataract surgery slides, I highly recommend that you do so prior to moving on to this section.
When it comes to cataract surgery, laser-assisted cataract surgery versus phacoemulsification is a hot topic amongst surgeons. I happen to be one of the world's leading authorities on this controversy. Recently, the Ascaris International Journal chief editor interviewed me about this. Just to give you a little background, here's what he wrote in the introduction to his article. Was this: reviewing the many studies on this technology is no easy endeavor, and I marveled at the thoroughness and the objectivity with which he independently undertook this project. He's referring to me. All ophthalmologists have the capability to do this, but I am not sure that anyone else has. Because of the favorable cachet that patients attach to laser cataract surgery, it is easy for surgeons in competitive markets to be influenced by fear. Our patients, however, trust us to employ our medical and scientific training to ethically and objectively decide what is best for them. I applaud Ken for striving to do just that and for being willing to share his exhaustive research effort with the rest of us. So let's look at this. Laser-assisted cataract surgery utilizes a high-speed laser called a femtosecond laser. So it's abbreviated FLACS, femto laser-assisted cataract surgery. The laser can be used to create the micro-incision in the eye that we talked about for phacoemulsification. And then it can be used to create the opening in the front of the lens, the circular opening that we talked about, so we can have access to the contents of the lens to dissolve with the ultrasound device. And then it can actually soften that lens contents, so less phacoemulsification energy is needed. So let's look at the case for FLACS. The idea put forward by the manufacturers and their consultants is that the laser creates a more precisely sized and circular capsular opening, so perhaps it holds the implant in a more perfectly centered position in the eye and therefore results in less of a postoperative refractive error, such as nearsightedness, farsightedness, and astigmatism. In other words, less need for glasses because the implant is going to be somehow better centered within the capsular bag, because the circular opening made in the front of the bag was more round and centered. And then the second thing they talk about is that less ultrasound energy is required, since the lens contents are softened by the laser, and therefore you may have less postoperative corneal edema. And if you have edema in the cornea, that's almost always just temporary, but it could cause some foggy vision in the beginning, and so this way you may have a faster visual recovery if less energy is used. Very rarely there can be permanent edema in the cornea, and the claim would be perhaps there would be less of an incidence of that as well, using the laser to soften the contents first. How about the case against FLACS? Well, they talk about a perfectly centered and very round capsular opening, therefore leading to a better position of the implant, and therefore leading to better vision, either with or without glasses. So you see in the upper right section here, these are the capsular buttons that were removed after it was torn manually by the surgeon to make the opening in the front part of the capsule, and you can see they're somewhat irregular. Down below you can see that they're perfectly round. These, of course, have been dyed blue for easier visibility. But the interesting thing is, study after study has not shown any evidence that the vision is any better with or without glasses. We know that less ultrasound energy is needed with the FLACS technique because the contents of the lens are first softened with the laser, prior to doing the phacoemulsification of the contents. However, numerous studies have shown either no decrease in corneal edema or maybe a very slight and temporary decrease. And one recent study showed a significantly greater amount of corneal edema with the flax technique when the 2.5 millimeter surgical incision is made with the laser instead of manually. One very alarming aspect to the flax technique is illustrated by these electron microscopic views of the edge of the capsular opening that was torn, that they say is so much rounder and centered. And that edge looks nice and looks round, like we showed you, to the naked eye, and even under the operating microscope to the surgeon. It looks very nice. But when you have a closer view with an electron microscopic view, it shows a dangerous looking rough edge. The lower two right electron microscopic views of the edge of the capsule are those capsules that were torn manually by the surgeon with the traditional phaco technique. But all the rest show the roughness, the ridges, the tags at the edge of the capsule, and that has clinical significance. What studies have shown is that there's a learning curve danger. For surgeons learning this technique, at least the first 100 cases have a much higher complication rate due to tearing at the site of those ragged edges. And even after the learning curve, studies have shown a significantly higher complication rate even for experienced users due to these edges tearing. As for making the entry incision with the laser, they are more ragged than the manual incisions, just like the capsular edge openings made by it. And as we discussed, it creates more corneal edema. The flax technique also adds about at least 25% more time to the procedure. And then there's the cost of flax. The laser costs $500,000, $50,000 a year approximately for maintenance of the laser, about a $350 charge to the surgeon every time it is used for each eye. And the surgeon has to pass the extra charges on to the patient. And so there's a considerable out-of-pocket expense for the use of this laser passed on to the patient. So at least in its current state, I like to say about flax that it's not a revolution as marketed to eye surgeons. It's not an evolution. It's really no solution at this point.